Welcome to Fireside Chat. My name is Sai. What I have in front of me is the hospital bill my wife got from the Summerlin Hospital in Las Vegas for her surgical procedure. We received this hospital statement on March 12th, and the billing statement was dated March 3rd, and they expect us to pay the bill by March 18th. So what if we never received this billing statement on time, or what if we received it after the due date? This is absolutely insane. This is why I really disliked hospitals and clinics and their billing systems. And I'm getting fired up just talking about this because they send you this statement and expect you to pay back right away. Our healthcare system in America has been broken for a long time. Medical debt has been a huge burden for millions of American people. Our hospital bill is $785.55 after the insurance paid most of the cost, and we're supposed to get another one soon. But remember that over 50% of Americans can't come up with $1,000. Most Americans don't have a fully funded emergency fund to pay for this type of medical debt in 6 days. Because we have a fully funded emergency fund, we were able to pay it off right away. Now, this video is not about an emergency fund. I want to talk about why millions of Americans have been drowning in medical debt for so many years. And think about millions of Americans getting these medical bills in their mail today, and they have to come up with payment within 6 days. According to the new data from debt.com, which is a consumer financial education company, 50% of Americans now carry medical debt, and it's become a crisis in America. 57% of Americans with medical debt owe at least $1,000 from diagnostic tests, hospitalizations, and emergency room visits, and 46% of their medical debt went into collections. And just imagine how that affected millions of people's credit scores. The medical debt crisis isn't just for uninsured Americans. We pay our monthly medical premiums to stay insured and make copays whenever we visit the ER, urgent care, or the hospital. If we needed to have a surgical procedure, the copays would just keep adding up. As many Americans struggle to make payments, they get letters and phone calls from the hospital, and then eventually the debts get sold to the collection. And many Americans decided to take out a personal loan or use their personal credit cards to pay for their medical debts and drown themselves further into debt with high interest rates. However, here's some good news I found from the Wall Street Journal. Beginning in July, Equifax, Experian, and TransUnion are going to remove medical debt that were paid after it was sent to collections. Whenever you have bills sent to collections, even after they're paid off, they would stay on your credit reports for up to 7 years. But this is good news because removing medical collection debt could boost your credit scores, and having these negative factors on your credit report could hinder you from getting a mortgage loan on the future. I want to emphasize that I don't ever recommend anyone from borrowing money unless it's for their primary home or rental properties they can afford. The credit bureaus are looking to remove unpaid medical debts of less than $500 in the first half of 2023. The Wall Street Journal reported that the threshold could rise above $500. The Consumer Financial Protection Bureau released a joint statement saying that this is an important step to support consumers in the wake of the COVID-19 pandemic. These changes reflect our ongoing commitment to help facilitate access to fair and affordable credit for all consumers. Keep in mind that this change is only for the medical debt that was paid after it was sent to collections. Also, these credit bureaus have to wait 6 months before adding medical debt to consumer credit reports, and they must remove debts that were paid by insurance companies. So now let's go back to that medical bill that we got less than a week ago. I've been to the ER, I've been to urgent care, and I've been to the hospital. They could never tell us what the total cost is going to be when we pay them a visit. Instead, they want us to visit the hospital website to get the cost breakdown. We don't find out until we get these billing statements. In 2021, the federal government ordered hospitals to publish a complete list of the prices they negotiated with their private insurers. And there have been cases where hospitals charge patients different amount for services like X-ray, MRI, or getting their blood tested in the lab. When you go to the hospital's website, they have tens of thousands of procedures in a spreadsheet with prices. How do we try to figure them out? To me, it just looks pretty deliberate for them to confuse consumers. One of the solutions is knowing your insurance coverage and benefits. We've had United Healthcare as our insurance provider for over 6 years, and we have a high deductible health plan, or HDHP, with lower premiums but higher deductibles than a traditional health plan like the PPO. For the family HDHP, the maximum out-of-pocket cost is $14,000. If you have the individual HDHP, then it's about $7,000. I always go over my medical insurance coverage and benefits, and I encourage you to do the same. Under my HDHP, there's no copay for annual physical, preventive screenings for cancer, high blood pressure, immunizations, and annual exams for my child. There's a $35 copay for urgent care, a $200 copay for the emergency room, and a $30 copay for therapy and counseling for emergency care. Keep in mind that these visits need to be within the insurance network. Otherwise, you would end up paying more money for the out-of-network providers. For hospital visits, and this is where it gets more expensive, it's a $500 copay for staying in a hospital for 1 or more nights for medical care or treatment, a $500 copay for maternity care, and a $250 copay for outpatient surgery that doesn't require an overnight hospital stay. Another solution these hospitals should provide is payment plans. In my experience, not all providers take payment plans, and many Americans end up using their credit cards and carrying their balances. If you got a $1,000 medical bill and don't have the cash to pay for it right away, I want you to contact the hospital administrator to work out a payment plan and see if you can do a 6 months or a 1 year payment plan depending on the amount that you owe. And you should ask for a interest-free equal payment plan with the hospital. So for $1,000, it would be $83 a month for a year, or $166 a month for 6 months. You might be able to reduce the amount that you owe by negotiating a deal to pay in full within 4 months instead of 6 months. Make sure you get all of this in writing from the hospital. And I also have the spreadsheet to calculate your medical debt repayment, and you can download it for free by visiting firesidechat.com/contact. And speaking of due dates, if you get a medical bill like we did and say that you got to pay back in full within 6 days, you need to call the hospital to request an extension. There are many billing errors in the hospital because they request payments from you while they're still processing claims with your health insurance company. If you didn't get one already, make sure to get an itemized statement from the hospital so you know what you're paying for. If you see that the hospital charges you $20 for a box of tissues, then you should ask them to take it out of the billing statement. You should only pay for the services and items provided to you. A lot of times, hospitals make errors on the medical bills and charge you for something you didn't need. If you have the cash to pay the total amount, you should still contact the hospital administrator to negotiate for a better deal. My wife got a 20% discount on her medical bill because she promised to pay it back in full on the due date. So our medical bill actually decreased from $785.55 to $585.24, almost 20% discount. Again, you need to negotiate with the hospital and see if you can get a better discount or some deductions, and if you have the ability to pay it in full. As soon as you get the medical bill, you need to contact the hospital immediately, or they won't hesitate to send your medical bill to collections if you don't pay it back in full after 60 days, which could hurt your credit scores. I had a friend who got charged $400 for something that he didn't even need from the hospital. He thought he had an agreement with the hospital not to have to pay that $400 back, but only to find out later that the clinic sent it to a collection agency. He never got it in writing from the hospital that the bill has been zeroed out. He's had that negative information on his credit report for several years now, so I'm hoping that this new rule would bump his credit scores. In order to protect yourself from these surprising medical bills, you need to have a complete understanding of your health plan and any restrictions on coverage and benefits. I would write down or print out a list of network providers in case of a medical emergency. I've learned from my insurance company that it's much cheaper to visit a urgent care facility than an emergency room. As far as how much you should save for future medical deductibles, you should check out this video about building your emergency fund to help you avoid going into debt.